Welcome back. A lot of the content of this particular lecture should not be new to you. So it's more going to be retouching on the importance of that concept rather than new information. Cultural and social diversity is likely to be a topic that's been addressed with you in your workplace somewhat recently. I think cultural competence is incredibly important because we're all different. And the culture itself of an individual does help to shape their sense of normalcy, their values, their behaviors, their understandings. And it's often hard to disengage from those cultures, as we shouldn't expect an individual to disengage. Multiculturalism, by definition, is the mixing of two cultures. So say somebody has immigrated from, we'll say, India to the United States, they're going to not leave behind, or likely not going to leave behind, their Indian traditions, but they're likely to also adopt some, American traditions. So, kind of that fusion or blend is the definition of multiculturalism. Differences between persons to persons are going to vary dramatically. It just kind of depends how in touch an individual is with their own culture based on the traditions that they observe and apply. So nationality, ethnicity, religious beliefs, all kind of tie into who a person is, and it's not our job to make a person believe what we believe. It's our job to be aware and be understanding of someone's cultures as we're caring for them. Healthcare is a great arena to work in because there is a lot of inherent diversity, and we're not just talking about diversity amongst the patient populations that we see, but really diversity amongst the healthcare professionals. A lot of physicians do come from international backgrounds, so it's important for us to interact appropriately from professional to patient, but also professional to professional. So essentially the success of what we do with our medical imaging exams, with our radiation therapy treatments, all goes back to communication and teamwork, and making sure that we can interact with individuals effectively, regardless of their inherent diversified nature, and that may be diversity in age, sex, race, religion, to name a few. I mean, there's all kinds of forms of diversity, and I don't want you to think of it necessarily as being, skin color. It could be their level of education. It could be their socioeconomic status. So there's lots of different ideas that need to be considered as far as diversity ideas, and making sure that we're aware and become on the same page as individuals that we're working with. For us to become on the same page with those we're working with and our patients, we have to understand that projections of behavior can be influenced by a variety of different factors. They can be very much personal in nature. An individual's given personality may reflect kind of their outward projections, but values, a specific situation. Maybe it's a trauma situation, the environment. The healthcare, the hospital itself does create a change in behavior for some individuals. So, behavior itself is going to differ from person to person, situation to situation, place to place, and the textbook does a nice job at defining different areas where these behaviors can stem from. So I encourage you to look through your textbook, look at these 5 categories here, and I think it'll help you understand maybe maybe you can't relate to a certain person, and I think if you can kind of plug them into one of these models, maybe that will help you better understand an individual. So at this point, go ahead, pause the video, jump into these 5 areas so you better understand them. So hopefully, after reading kind of those specific behavioral types of models or approaches, you can maybe better understand some individuals that you previously perceived as being difficult. Difficult to you, yes, but remember, there's some underlying meaning there. So. Nonetheless, to continue on with specific interactions, certainly this point has been brought up in just about every lecture, but essentially, quality of care needs to be provided to the individual patient, regardless of their conditions, regardless of their beliefs, their philosophies, their mentalities, their behaviors. We need to provide the best possible care that we can. Suboptimal care goes against our standards of ethics in the ART, for example. ASRT has a code of ethics, code of conduct. So those types of things that are important to understand, that we are responsible to provide the best care possible, and we have to remember to remain culturally sensitive and understanding to patients, and not try to change their beliefs towards our beliefs, or even just to interpret their actions through our vision and our philosophies. We have to try to understand theirs first and foremost. So perceived care, it's the most important type of care that we can essentially provide. So it's not actual care. It's not about what we're the actual good that we're doing, but it's all about how the patient perceives their experience. Because we have to, in the end, allow that patient to go home nice and satisfied. So how a patient may perceive their experience may depend on a variety of factors. Time of day, I think, is one of the more interesting ones. Some individuals, some patients may do better in the mornings than they do in the afternoons. Others may do better in the night than they do in the mornings. So, it just kind of depends on that patient. So they may draw an appointment time that they're not necessarily too fond of. So, that may impact their perception. But we talked about kind of those personal natures, but patient status also, reflect back a couple lectures ago, ties into things, and just the environment and the openness of the staff are all going to impact perception. So just kind of keep those types of things in mind as you're interacting with patients, specifically patients of different cultures. So now to talk about a little bit more about how these interactions take place. In Western cultures like the United States, it's perfectly acceptable for a male patient to see a female provider, a female patient to see a male provider. There's not a lot of divisions. Sometimes you may have specific preferences, as far as your comfort zone, or maybe the specialist that you're trying to see for a specific exam. You may have some preferences there. But not typically like the preferences that are exhibited in Middle Eastern cultures, which prefer, female patients to see females and male patients to see males. It's important to recognize those types of things, because if the patient, the Muslim female patient is the next patient up, it's important for the female to take that exam, rather than the male technologist to take that exam. So you have to just be aware of those types of things, and things can happen by chance. We'll just say, a female technologist takes a Muslim patient for a chest X-ray, and you pop in out, in just to see, hey, do you need any help, type of thing, and that may create a total freak out. If me being a male, I walk in and say, just asking for help, because now I may, she may be exposing her skin because she may be in a gown, her hair may be exposed, those types of things. We have to be just nice and culturally sensitive and aware. Even if it's by accident, you have to kind of, be understanding of those types of things. So, keep those types of things in mind more than anything else. Family members may accompany specific patients of specific cultures. Males may accompany their wives. So we have to be, allowing of those patients to kind of jump into the examinations with us. And of course, we have to remember sound radiation protection philosophies that are go along with that. But also being respectful of the cultural needs. Personal space is something that's interesting. Great Britain, they don't like a lot of touch apparently, but Italians, Spaniards, and Arab cultures prefer a little bit more closeness. So Arab cultures, though, you gotta be careful, because males aren't supposed to put their hands on any females. So no touch is allowed. So you just have to be very, very careful. Other things is that Asians by nature tend to be more keep things in confidence more than some other cultures. So they may have difficulty expressing their patient histories or their why they're even there, their illnesses with you as the technologist. So keep these types of things in mind. Hopefully, you learned a little bit, and just remember to be sensitive to that patient's needs. So next is religion, and religion and culture certainly go hand in hand. In this particular section, I think the textbook makes its best point, saying to never incorporate your cultural beliefs into another patient's culture. It's not about us, it's about the patient, it's about us learning to adapt to their philosophies and be supportive as we're providing care. So they make specific mention of fasting that may be involved with specific religions, Christianity, Muslim-based religions, during the Lenten season, during Ramadan as well. So each religion has its own customs. So just kind of understanding and being aware of those, I think, is important. Now, the final couple points surround the idea of language. So, patient-centeredness is dependent on effective communication, and we can't effectively communicate with every single person. When you think about the cultural differences as far as language barriers that may be created, we talked about the importance of nonverbals previously, but it's important to understand, even if the individual does speak. English, we speak English, they speak English type of thing. It doesn't mean that all of the words that we're saying have that shared meaning. And it can create that misunderstanding. Word equivalencies may not exist. Meaning from one word may mean something completely different. So, some general language-based tips is to minimize any technical jargon, use of acronyms, anything that can lead to additional confusion. Make sure you avoid. Nonverbals have to be strong because they can just a patient can read so much into your body language, the way you're speaking to them. If interpreters are available, certainly use them. That can help decrease any unsureness about procedures, still allow for questions and answer sessions to take place. It's important to make sure that we are always listening to the words that we're saying, that the patients are saying to us, rather than how they're being said. So make sure that we're kind of paying attention and being focused on that patient and what they're saying, rather than how they're saying it, more than anything. So now a few other pieces to kind of keep in mind is that certain cultures don't want you just to jump into the exam. They want you to be able to communicate a little bit, have some that small talk, those social courtesies ahead of the exam. Other times, how you refer to a patient matters. Some patients aren't going to be accepting of a first name being called. Other patients, go by their last name or their family name first, followed by their first name. So order is important. I think the most effective way, I guess my recommendation would be to err on the side of caution and use a Mr. or Ms. Rather than a first name. Certainly avoid the sweeties, the honeys, those types of things, those types of talks may be perceived as being disrespectful. Not calling somebody by name can really impact a patient's perception of that experience. Body language and signs may be misunderstood from culture to culture. Indians, the up and down, yes to us means no, and then the side to side, no means yes. Asian communities, eye contact is something that's frowned upon, direct eye contact. So just kind of keep these types of things in mind. We don't want to be, unaware and be offensive. So I think it's important to draw your attention to some of these things. Other things with the Asian culture itself, and kind of getting away from the language and getting a little bit more back into the age piece, is that elderly populations are very, very highly regarded in Asian cultures. So just be as respectful as possible to all patients, but just kind of keep that type of thing in mind. Is the other cultures do have more inherent, I think, respect for the elderly population. So these are all just points, little food for thoughts to kind of keep you thinking and understanding that. We need to be respectful of patients' wishes, of patients' needs, of patients' cultures, of patients' senses of individuality. So, trying to understand their behaviors is important, kind of on a exam by exam basis. So, keep up the good work. I'm sure you do a great job, but try to intertwine a few of these concepts in your daily work lives. So that's that, and I hope you picked up on a few things that can make you a little bit more patient centered.